A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a high-stakes Senate confirmation hearing, Dr. Mehmet Oz, former television host and President Donald Trump's nominee to lead the Centers for Medicare and Medicaid Services (CMS), found himself under intense scrutiny from Democratic senators over his past comments and potential cuts to critical healthcare programs. The hearing, held before the Senate Finance Committee, marked Oz's return to the political arena following his unsuccessful bid for a U.S. Senate seat 3 years ago. During his opening statement, Oz highlighted his accomplishments as a physician and TV personality, touting the 10 Emmy Awards his show had won and asserting that Trump wants to love and cherish Medicare and Medicaid. He emphasized that there exists a generational opportunity to fix our healthcare system and help people stay healthy for longer. However, his remarks did little to quell the concerns of Democratic senators, particularly regarding his stance on Medicare and Medicaid cuts. Senator Ron Wyden, the ranking member of the committee, confronted Oz about his previous support for Medicare Advantage companies and what he termed baseless wellness remedies. Wyden warned that if confirmed, Oz would have the power to make decisions regarding cuts to these vital programs, stating, "Dr. Oz will be calling the shots of what gets cuts, or what stays." When pressed by Wyden on whether he would oppose cuts to Medicaid and Medicare, Oz's response was vague, leading to frustration from the senator. "I cherish Medicaid," Oz stated, but he did not provide a clear commitment to protect it from budget cuts. This evasiveness was a recurring theme throughout the hearing. Senator Maggie Hassan of New Hampshire challenged Oz on the implications of children losing health insurance under potential budget reductions. "How many children losing health insurance would be acceptable to you?" she asked. Oz replied, "I don't want children to lose health insurance," but Hassan pointed out that supporting the Republican budget could lead to such outcomes. The hearing also delved into Oz's controversial past, particularly regarding his promotion of green coffee extract as a weight loss remedy. Senator Hassan highlighted that a study Oz previously cited was retracted, and an investigation found the data to be deeply flawed. This raised significant concerns among committee members about Oz's credibility and judgment. Democratic Senator Elizabeth Warren was particularly vocal, expressing her worries about Oz's financial ties to healthcare companies and his past comments advocating for the privatization of Medicare. Warren criticized Oz's stance on abortion rights, highlighting his previous remarks suggesting that decisions about abortion should involve local political leaders. She condemned this implication as terrifying and antithetical to patient health. Republicans on the committee came to Oz's defense, emphasizing their agenda for the agency, which includes upholding the Hyde Amendment that restricts federal funding for abortion. Senator Steve Daines of Montana questioned Oz about his commitment to uphold this amendment if confirmed. Oz assured him that he would. The hearing also touched on Oz's tax returns, with Democrats alleging that he had underpaid Social Security and Medicare taxes through a limited liability loophole. Committee staff indicated that he avoided hundreds of thousands of dollars in taxes during the years reviewed. Oz's team maintained that he was not liable for the taxes in question. Throughout the hearing, Oz reiterated his support for Medicare Advantage, a program that has gained popularity among beneficiaries. He argued that competition among plans leads to better care, a point echoed by health policy analysts. However, his past proposals to expand Medicare Advantage raised eyebrows, especially given his personal investments in healthcare companies. In a 2020 op-ed, Oz suggested that Medicare Advantage could be expanded to all Americans not on Medicaid, funded by a 20% payroll tax. This raised concerns about potential conflicts of interest given his financial stakes in the healthcare industry. As the hearing progressed, it became clear that Oz's celebrity status as a doctor was not enough to shield him from the tough questions and scrutiny of his record. Senators expressed their hesitance to approve another Trump nominee without a thorough examination of their qualifications and past actions. With rising measles cases and public health concerns taking center stage, Democratic Senator Ben Ray Lujan of Arizona questioned whether Oz would be able to address critical health issues effectively if confirmed. Lujan's remarks reflected a broader concern among Democrats about the direction of healthcare policy under a Trump-appointed leader. As the committee prepares to vote on Oz's nomination, the outcome remains uncertain. The hearing has sparked a broader debate about the future of Medicare and Medicaid, and whether Oz's leadership would align with the needs of vulnerable populations. With the stakes higher than ever, the Senate Finance Committee will ultimately decide whether Dr. Mehmet Oz is fit to lead the agency responsible for overseeing the health care of millions of Americans. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.